Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and as always, I'm excited that you're here. And I could not be more excited to have such an esteemed guest today. We have Doug Brown, who is an industry veteran of dentistry for over 30 years of experience building national DSOs, establishing and serving as president of the ADSO, serving on advisory boards of 2 dental schools, and founding a nonprofit dental clinic that also serves as a training and research center in collaboration with the UNC Adams School of Dentistry. Doug is co-founder and managing partner of the Dental Innovation Alliance, a venture capital fund that invests and supports early stage dental technology companies. He serves on 10 boards, mostly in the dental industry, and lives in Cary, North Carolina. Doug, thanks so much for being on the pod.
Thank you for having me, Brian. It's great to be here.
Well, you're obviously a well-established industry veteran and have done a lot. And so when you co-founded Dental Innovator Alliance, also known as DIA, what is DIA and why did you start it?
Well, it's a platform that's specifically designed to connect literally hundreds of innovators, mostly technology-focused people, with the industry veterans that can help them. It can help them through guiding them on their path to success and getting their product out there. And these folks are connected into the industry and can provide market access. They can provide guidance at the board level and simply can help them be successful. So it's a unique model. Our whole goal is to de-risk the investment that typically early stage companies carry more risk. There's more uncertainty. But if you can help guide them through sales access and to get their product in the marketplace, it's a winning combination for both the innovators and for the investors.
I'd like to unpack that a little bit because somebody who's been involved in several early stage technology companies and seeing oftentimes, I'm a little biased, but I think that there's a lot of innovation that comes at that early stage level. But like you said, so I'll make a statement and then you can either validate or discount it, that it's I think it's even more difficult in dentistry for an early stage company to get access and traction than it is in a lot of other industries, particularly like the consumer market, because there's these sort of entrenched people in place that makes it difficult to kind of grab a foothold. Would you agree with that?
I think so. I mean, dentistry for 100 years has been a cottage industry. It's been solo practitioners doing what they've been taught to do in dental school. And when you get into the real world, it's different, and it's very easy to be in a mode of doing things the same way. I think there are market forces out there that are changing that. Staffing shortages, inflation, high cost of capital. And so if you do things the same way, your margins are going to get squeezed and you're going to have a difficult time growing and having a successful practice. I would also say that the emergence of group practices, whether they're within a market, 10, 20 practices or dental support organizations or DSOs, you now have more resources. You've got business people and clinical people that are not at the chair for 4 or 5 days a week that are helping dentists look at their options and to think outside the box. And so the combination of kind of economic need, the business people and clinical directors of some of these larger organizations have a tremendous incentive. And now we have literally hundreds of companies that are there to serve these needs. It's a great time for dentistry.
Yeah, I agree. And I think it's a time of rapid change. And you're sort of one of the people that's on the tip of the spear of that and helping guide the direction. So, what are the trends in dentistry that you're most excited about?
Well, I think I mentioned hundreds. We are now getting, on average, one new company per day that is here to serve the dental industry. Now, not all of these are great ideas, right? By definition of our CRM with 700 companies, not all of them are going to be successful. But among them, there are some number, a dozen, 50, 100, that I believe are going to change dentistry for the better. And this is not just a device, a new gizmo in the clinic. It's not just business systems or SaaS products. There are therapeutics. There are new services. There's new ways of finding temporary labor very efficiently and very cost effectively. The ideas are amazing and they're varied. And so we're open to all of them. We're within a niche of dentistry, but we're very broad in our thinking in terms of the types of solutions that could be effective in helping dentistry prosper into the next decade.
So what's one transformational concept that you've run across that you're excited about?
Well, I think you're familiar with this company, Brian, but it's Dentagnostics, and it's a therapeutic, rather I should say a diagnostic product. It basically is a saliva test that allows a dentist to very reliably and very quickly assess the probability of a patient developing periodontal disease in the next several years. So it's well ahead of any visible signs of periodontal disease. So you can imagine this is an ability for a doctor, a dentist, or a hygienist to say, this patient is going to high likelihood develop periodontal disease, and what clinical protocols can be put in place now to prevent that from happening. That's in stark contrast to traditional ways of dentistry, primarily treating a disease that's already present there. So I think that's transformational.
Yeah, I think for me, it kind of checks all the boxes of the trends that are going on that, anybody that listens to this podcast knows that I'm passionate about taking information and leveraging it to come to the new level of diagnostics. We can also predict outcomes and all sorts of things that we're doing by leveraging data and new technology. Also, if you think about it, it's at the intersection of the medical dental connection. There's a lot of the connected dentistry trends as we talk about that is being part of. I like to think of it as that's a dentistry 3.0 technology. It's not a digital piece or an analog piece. This is a connected piece where it's taking different different aspects of diagnostics and putting them together to create new workflows. So I think I agree. It's a company I'm familiar with and I'm also very excited about.
Well, and everybody wins. The patient certainly wins. The dental practice wins because they can supplement the great work that their hygienists are doing, and dentistry moves forward.
Yeah, I think that's one of the great things about dentistry. With when done right, everybody wins. And you're exactly right. So let's talk about the flip side of, there's lots of exciting hundreds of companies that you're talking to that have dozens of good ideas. What trends do you see that are concerning you in the industry today?
Well, some of them are commonly known, Brian. I think labor shortages, particularly hygienists, dental assistants to some extent. Inflation is like most businesses in healthcare. There's a limit on how much fees can be raised to cover the cost of inflation. So margins are being squeezed there. The cost of debt, whether that's a private practitioner who's carrying a note and the interest rate is going up, or the large dental support organizations that finance their businesses, their purchases through debt. So they're getting squeezed as well. I think the other thing that I see here is that I do think that the growth of dental practices, the number of practices will slow because of these issues. I think that's a bad thing and a good thing because more access is needed, particularly in the non-urban areas. There are a number of dental deserts in this country. I think it's a good thing, maybe at least in the short run, because dentists and their business partners can and should focus on making the practices they have more efficient and more focused on the needs of patients. And so, as opposed to looking at unit growth, if you're, let's say, a CEO of a dental support organization, let's grow the practices we have, and let's solve some of these problems that if we don't have enough people to run the dental practices, let's use technology to fill the gap. And I think that's where DIA really comes into play here, because there are many, if not most of our solutions that are very much focused on that one issue. How do we do things more efficiently, more effectively, and have greater outcomes for the patient?
Yeah, I think I'm a firm believer that in every problem, in every crisis, there's opportunity. And like you mentioned, when the COVID pandemic hit, everybody's worried about restaurants. And obviously the week kind of went by the wayside, but on the other end of the pandemic, it's just under 20% increased profit for the restaurants that remained, primarily because they learned to they learned to do more with less people by implementing technology. And they just learned much more to go orders and online orders and things like that. So the average restaurant went up. I think it was either 17 or 18% in profitability post pandemic, and they did fine during the pandemic. The ones that knew how to adjust. So do you see dental practices? And I'm putting words a little bit in your mouth that I feel like they're because with these winds of change. I feel like that's similarly going on in dentistry. We're just lagging, where the practices that make the changes, that implement the technology to overcome the sort of winds of change that are happening will thrive, and others will do the opposite of thrive. So, a do you believe that to be true? And if so, what can dental practices do to make sure that they incorporate the right technologies?
Well, I think they have to, the leaders, typically the dentist, will have to find time to really swat their practice. There has to be, if you're filling your schedule and you're grinding away the same way you always have, and you're not taking time to really understand the 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 weaknesses in your protocols, your processes within the practice, the weaknesses of your people, the systems, you're going to get the same results. And in fact, the results will be worse because these economic pressures that I mentioned will get the better of you. On the other hand, if a dentist were to take a half a day a week for 2 months and sit down with his staff and say, or her staff, and say, what can we do better here? What is not working? Who can we turn to, and maybe other colleagues outside of your practice that are doing things better? What resources can we bring to bear in terms of the technology that's out there? And let's make changes. Not only will the practice get better, but the patient experience will get better and the practice will grow. So I think investing, being introspective and investing in researching what's working outside of your practice could be immensely powerful for any dentist, no matter how good you think you're doing.
Oh, that's great. Well, because you talk with obviously a lot of dental practices and large groups, what do you think is the biggest mistake, or on the flip side of that, what's the biggest opportunity that you see in dental practices today?
Well, it's pretty much, Brian, what I just said, and that is there is a wealth of, now the internet's great. You can find so much out there. You just need to know where to look. I think dentists that invest their time in study groups and what their peers are saying. I also think that openness to different types of models, and not every dentist is equipped to be, both a serious and successful clinician and a business person. And so being open to models that are different, and that includes dental support organizations. And I'm seeing a number of dentists who for years really put off even considering that option, that had made the decision to with great success, and their lifestyle is improved in many ways. I think being open-minded, I think, and being aware of a better way to do anything, whether it's a procedure, whether it's a business process, whether it's the types of people that you have in your practice that are either helping uplift the patient experience or bringing it down. Being open to change.
That's great. I think it's the best time to be a dentist ever because you can choose to be, never been a better time to just focus on clinical care and let somebody else, handle everything else. It's also a great time if you want to, you know, take your clinical knowledge and either help lead part of an organization in clinical or 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 be more on the business side. And kind of your point, I think you can do both, but you have to be exceptional at both and really pay attention to what you're focusing on your education because there's gaps in the knowledge of obviously coming out of dental school. And if go to every year, you love going to the same lecture about bonding strength of your resin. It's not, you're not going to be learning, there's other people in a group that are taking, you know, probably their entire career and just focused on branding as part of their marketing strategy, and then people with social media and everything else. So you can do both, but it takes a it takes a special level of excellence that, when I came out of dental school, wasn't required to do both, I think. But I think that having that sort of good options in your career, much more varied options today, is a big positive for dentists.
Yeah, and maybe adding on to that, Brian, the trend in consolidation into DSOs has obviously gone to some very large organizations with over 1,000 practices. But I think probably the most exciting part of this is the dentists that have one or two very successful practices and they are entrepreneurial and they do want to add a third, a fifth, a 10th, or a 15th practice. And they have the energy and the knowledge and the idea to do it. And dentistry is great because there are so many ways to be successful. There isn't a single path, there isn't a single model, there isn't a single payer mix or a procedure mix. There are many ways to be successful. And I think as I look into the organizations like ADSO and DEO, I see just tremendous talent and energy. And those are the folks that I think are really going to create the next wave of successful industry.
What a great note to wrap up on. I couldn't agree more. So, Doug, where can people go out to find more information about DIA and what you're up to?
Well, probably start with our website, dialliance.com, or you can email me at doug@dialliance.com. Either way, but I would be happy to get back with you, answer any questions about what we're doing, DIA, any of our portfolio companies, and just reach out.
Well, thanks for being on the podcast, Doug, and thanks for all you do.
Thank you, Brian. I've enjoyed it. Take care.